regular scheduled meeting of the Southampton Local School Committee, Wednesday, August 11th, 2021. This is the first meeting since the election, so the first order of business is the annual reorganization.
Good morning, good evening, everybody, and welcome for joining us. And there are some procedural steps that we need to take in this first annual reorganizational meeting. And the first would be to call for nominations for the chair of the Southampton School Committee. So at this time, are there any nominations?
I would like to nominate John for the chair.
Any seconds?
I'll second.
Are there any other nominations on the table at this time? Anything up for discussion at this time? Okay. So at this time, we'd like to take a vote, and each person gets one vote. And at this time, everybody in favor of John Lumber as school committee chair, please say aye.
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 So it's my pleasure now to turn over the meeting to John.
Nominations for vice chair. I'll nominate Austin.
I'll second.
Any discussion? No? Nomination for clerk?
Do you want to vote on it?
Do it. You want to?
As one package?
Yeah.
Okay.
Clerk?
Nominate Allison.
Second?
Second.
I'm not seconding myself, no.
All right, those are the two officer spots, so we'll vote. All in favor of those two?
Aye.
Aye. Opposed? So moved. Now we need liaisons, Hampshire Regional School Committee member, which is a voting member, school council, representative CES, finance liaison, and PTO liaison.
I'll stay in the PTO if you want.
Okay?
Nominate Allison for the PTO.
I already have to go to finance for select board, so I can take that one.
I can continue with the collaborative. Now I can attend the meetings since we changed our meeting.
I'll do the,
Austin, you want to just clear the
School
other two
council.
for now?
not the other two, I'll do school council.
Anyone for Hampshire Regional? No? All right, so we'll leave that one open for the moment. Just vote on those. All in favor? Aye.
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 Opposed? Okay. Approval of the minutes. We have 5 sets of minutes, April 26th, April 28th, May 12th, May 19th, and June 9th. We can take them all together as a package unless there's adjustments or modifications that you want to do.
I went through all of them today and they were pretty straightforward. I would vote for them to be approved.
Motion to approve as a package by Allison,
Second.
seconded by Austin. No discussion. All in favor?
Aye.
Aye. Opposed? So moved. Next, we have public comment. The committee traditionally sets aside at least 10 minutes of public comment for any member of the public that wishes to speak. They do not have to be a resident of the town in order to speak. They just have to have some sort of connection with Norris. We ask that in the event there are multiple people that want to speak, that everybody speaks once until everyone's had a chance to speak before they come up a second time. And we generally limit the initial speaking to no more than 3 minutes. Since there's an audience, you want to set the initial time at 15 minutes? Okay. All right. So any member of the public that wants to speak can come up to the podium. We just ask that you identify yourself and how you're connected to Norris. And then you'll have the floor for 3 minutes.
Hello, my name is Carol Barkham, and I live 78 Pleasant Street, and I have a child at the Norris School as well as at Hampshire Regional. I'm requesting that the Southampton School Committee vote that masks be worn on a voluntary basis in school. The American Association of Pediatrics, the CDC, DESE, and the Department of Public Health have not mandated masks. Please follow the guidance of these agencies by letting the families make this decision for themselves. In the absence of an actual mandate, there is no justification for the Southampton School Committee to require masks. Last night, the Board of Health voted to require masks in municipal buildings. The Board of Health has previously stated in the attached letter that their only jurisdiction with regards to the school is contact tracing and quarantine. Those are hyper-local issues that make sense for our board to handle. While I appreciate their dedication as part-time volunteers, it's unreasonable to expect them to have the power to override the offices of the CDC, DESE, Department of Public Health, AAP, the governor, and other entities that exist to process and interpret data and to make regulations in our best interest. As of today, these agencies are leaving it up to families to decide, and we are asking that our town officials respect that. There is overwhelming support in favor of this request. I have attached a list of over 100 signatures of residents who feel that masks should be voluntary. The rapidly compiled list includes residents that are parents, grandparents, teachers, paramedics, firefighters, police officers, and nurses. Also included are people who were prior fire chiefs, select board member, emergency management director of Southampton, a Massachusetts Department of Public Health official, and many more well-respected people from our community. These residents elected you and have trusted you to hear them and vote on their behalf. A decision of this magnitude should be made based purely on facts and measurable data. In the event that the Southampton School Committee or Board of Health puts a mask mandate in place, I would like to know what the metric is being used to determine its necessity, the case rates, mortality, etc., and what clear and concise goals need to be met for it no longer to be a concern. Anything less simply contributes to misinformation, and it benefits no one. Thank you.
Mrs. Barton, did you want to submit the signatures and all that, or did you, via the email, use that one?
I emailed everything.
Okay.
Do you want a hard copy of it?
No, we can use the email version if you want, that's fine.
Do we have to be,
And I also submitted a copy of the email from the
Yes,
Director of the
as
Public Health.
the two attachments?
Yep.
Yes,
do we have to be masked now?
Yes.
supposed to be.
Yeah. Anyone in the audience who doesn't have a mask, can you please put one on by order of the Public Health Department?
Anybody else who wishes to speak?
Hello, Mike Cianciolo, 116 Middle Road, Southampton. I have a daughter in school, third grade, going into third grade this year. I am standing today to ask for a mandate for masks in the Norris Public Schools due to the fact that there are no vaccines available for that age cohort at this time, and it is a proper and due course to ensure those safety protocols. And while there may not be mandates by several agencies, there are strong recommendations for mask mandates in public settings across the board. So I would appreciate your consideration of that. Thank you.
Before we have any more public comment, can we ask everyone to mask?
Well, we did. This body doesn't have an enforcement division.
Okay.
Did you want to speak?
My name is Katie Davio. I have a son who is going into kindergarten in Norris this fall. And I also have a son who just finished his first grade and is going into second grade. I'm here today to echo a lot of the same sentiments as Mrs. Barcombe. I'm here to ask that this committee consider making masks optional for families. I feel strongly that we don't currently have any mandates coming down from our governor. We are no longer in a state of emergency. We do not have any mandates coming from DESE, and I think it should be parents' right to choose. While I respect everything and all the work that all of you folks put into the school committee, I also don't think it's fair that you get to make a choice for every parent and every family on this matter. Everyone has experienced COVID differently. I'd like to share a story about something that happened to my son last year at school. He was coming home pretty much every day with a sopping wet mask, and I gave him a clean, fresh mask every day at school. He was chewing on it, sucking on it. It was a major distraction for his learning. He started a habit of chewing on it, and it was actually creating holes in his masks. And one day towards the end of the school year, he actually chewed a piece of his mask off, and he swallowed it in his classroom and was choking. He was afraid to put his mask down because he thought he would get into trouble. So his teacher sent him to the school nurse, not really understanding that what was happening to him. He went to the school nurse, and she gave him some water, and then he was dismissed on the bus home. He was hysterical on the bus. His bus driver had no idea what was going on with him. He had told him to take his mask down, but he was afraid that he would get in trouble if he did. Needless to say, I met him to get off the bus, and I couldn't even make out what was going on with him. He was crying hysterically. We went to the ER. They couldn't quite figure out what was going on with him other than putting him to sleep and putting a scope down his throat. And I endured listening to my kid cry, begging me not to die. It was heart-wrenching. And we have very little follow-up from the school on this incident. He actually didn't eat anything but yogurt drinks for 3 weeks because he was convinced that there was mask stuck in his throat. We had countless visits to his pediatrician, who basically said that he had experienced a very traumatic event, and because of that, he was convinced that there was still mask in his throat. And so no one understands what we went through. And so while some families, masks are okay for their kids, my son struggled with them. And he was terrified of wearing masks after that. I mean, didn't like it to begin with, but the anxiety with wearing masks became even worse. And he's an active kid, so he would be at school at recess, huffing and puffing into this thing every single day. He definitely experienced heightened breathing, which we know does cause anxiety in children. And he is terrified of returning to school. He is terrified of having to wear masks. And as I said, we had no follow-up from the school or anyone as to how his condition was or how he was doing. Some kids are really struggling with masks, and I think that needs to be a consideration. Masks, I have my kindergartner, I'm very concerned about him coming into school with a mask. He went to Gorse Children's Center for the last several years, which is a private preschool in South Hadley. He was a K-Prep student last fall, and the school opened up with 92 students. No one wore masks, and there wasn't a single issue in the school. There was no quarantine. They were open 5 days a week. There was no shutdowns. And it kind of shows the science that children really aren't super spreaders of this event. I think the complete loss of human connection that our children are going through over these last year and a half is terrible. And as I share this story about what happened to my son Jackson, I'm curious if this committee does mandate masks, what kind of protection is going to be given for my son to go to school and feel safe every day? There's parents that want masks so their child can feel safe. Well, how about my child? He deserves to feel safe at school as well. And they deserve to have human connection, and they deserve to be able to visualize expressions and visualize how words are being said and how words are being pronounced. This is going to be a big issue for my kindergartner, who already has speech issues, who has asthma, and I'm nervous about him going to school in the fall. I'm asking this committee to please give particular attention to the younger grades and how you're going to handle them, because they particularly are trying to learn how to speak, letter sounds, reading, and having a mask on is really difficult to do that. I guess in closing, I would just say that we're stealing a normal childhood away from our kids, and I'd really be interested to know if anybody on this board has done any medical research as to what the negative health impacts are of long-term mask wearing in children. Some of these kids are wearing them for 6, 7, 8 hours a day. That's a lot for young kiddos. And it just, frankly, it's not normal to have a cloth mask over your face all day long at school. It's just not normal, and it's hard. And I think that while it's great for some families, and some families it makes them feel safe and comfortable, it's not great for every family. It's not great for every kiddo. And what's going to be done for those kiddos? What kind of concessions are we going to make for those kiddos? Everyone should have the right to feel safe, their child feel safe at school. Thank you.
Anyone else? Francine?
Francine Tishman, Glendale Road. I just want to remind everyone at this meeting that it's posted on the door that the town hall and town buildings, you're supposed to wear a mask. That was passed last night by the Board of Health. All the residents were notified by the code red alert that went out over the phone. And I believe it's been on Facebook.
I
So
didn't,
it just asks people to abide by the rules.
I didn't notice whether or not there was an available box out there of masks in the event that somebody was at work and didn't get the message.
I didn't get the message till a half hour ago at my house.
Well, if you're not registered for code red, you wouldn't get it. But if you are registered, you would get it. And all I'm just suggesting here is that there is a sign on the door, code red or not, that asks people to wear masks coming into the building.
Okay. Did you want to speak?
I did not plan on speaking tonight at all, so I'm just here listening and hearing everyone. I'm Alice Badaker. I have a son that's coming into kindergarten this fall here at Norris. And I'm also a teacher, so I've been living this firsthand, and one suggestion I might have for your child, and if this goes to mask, and I'm just, in case I forget to tell you, there are those plastic cups that you can put behind the mask. I don't know if you've ever seen those, but I wear them when I'm teaching, because when I'm teaching, I'm sucking in like that all the time. So our district is going through this too, and it's a very hard thing to go through. So people that are making decisions, I totally appreciate all the work that you're doing and the choices that you have to make. In our school district, our superintendent has a lot to say and do with this, so I'm kind of new to this in Southampton, how you guys handle it here. But one thing I can suggest, and I don't know how they're doing it at Norris, but is maybe having the kids have more mask breaks. Like if the kids are wearing them for 6 hours, that's a really long time. We don't do that where I teach. We give the kids a break, and we actually teach outside whenever possible. And if they're out at recess, they don't have to wear them. We kept lunches in the classroom, so they were not mixing in the cafeteria. So in whatever decisions you make, maybe do research too on what other districts are doing and how they're handling it. I teach in a very large district. We have 11 elementary schools, and the kids we did have COVID in our buildings. Our children got it last year. We had a set of twins that had it. The first kid in our school that got it was a third grader, and some of them got sick. We had families that got it. I had it. Our whole family had it. My daughter's a paramedic, so she brought it home during all the beginning parts here. So it's scary when you do have it in your house. And, most of all our teachers are vaccinated where we teach, so we're going back full mass and all in. We came back May 6th last year, and the kids had a choice. They could do full remote or full in, and that was it. They couldn't do the back and forth hybrid anymore. So I know our district is already setting up plans to go hybrid again too. So I think we're just at a start of a whole new, I don't think we can compare last year's COVID to what's going on right now, based on everything I'm reading. But, the kids, they handle it, and some have issues that it makes it more challenging for them. We have kids with special ed needs and things like that, and it's difficult for them. It's really distracting for them. So I totally understand, children that have challenges with that too, but maybe we can have something in place where you're considering that, or giving them more time out where they can take their mask off and take a lesson somewhere else, smaller groups, something like that. So whatever you're putting in place, if this is just a decision to make it be all mask or not mask, but also put some other considerations in there for like a student like this mom has here. So I would be happy to offer any suggestions or any experience I've had with it. I can tell you the teachers hate it just as much as the kids and the families and the parents. My son's been wearing a mask in preschool. you know, his preschool was mandated masks, in that where he went, this was in Connecticut, but still, you know, he does okay with it, but he also has been going to Norris for speech too, and that was like a huge issue because the teacher can't even see what he's doing, you know, so we had to do the shields and things like that for them to be able to see his mouth and what he's saying. So, again, I didn't plan on talking, so I wish you the best in making your decision, and I know it's a hard decision to make, and everybody has different viewpoints on this for sure.
Thank you. Anyone else?
Can I add a comment?
Is there anybody else that wants to talk? Go right ahead.
Thank you. Mike Cianciolo, Southampton, Middle Road. You know, last year when we went into this, we had the option of, you know, making our kids full remote work from home basically, which we chose to do as a family. Great personal sacrifice, obviously, to do that. I think my daughter hated it more than I did. In fact, I'm absolutely sure of that. But I would say at this point, Desi, I don't believe has any plans to even have that as an option going forward. So really what we're talking about is putting kids back into the school environment, or putting kids back into the school environment. And so, you know, with that in mind, I don't have a choice to send my child to school. So I would really appreciate the masks being in place to keep everybody safe. I don't think it's a personal family choice issue. This is a public safety issue. And really that's kind of where I stand on it. Thank you.
Thank you. All right. Anybody want to go a second time? Do motion to close public comment? Oh. No, that's all right.
It was first on the agenda.
I'll be quick, so everyone gets 3 minutes. You just have to state your name and some relationship to Norris. In order to speak.
My name is Kathy Thibodeau, 16 Old County Road. I don't have a kid in Norris.
Well, you're a resident though, so that's okay. Go right ahead.
Okay, I don't have a kid in Norris, but everyone is treating this as a community issue. So as a member of the community, I would like to have a say. I ran here. I understand it's a sensitive issue. There's a lot of personal feelings, and people would like to be able to make personal decisions about that, and I respect this. I feel as though no one in the town is qualified to make decisions for everybody else in town, especially when all these other organizations have said it's a recommendation and it's an advisory. I think to go against that and to act as if we should do something beyond what the experts has recommended opens us up to liability, and it could be very foolhardy. We just don't have the resources to do the investigation into how the data is being collected and interpreted the way the government officials do right now. Thank you.
Thank you. Anyone else? Last call. We'll end public comment at 5:54. The only correspondence that I received was Mrs. Barkham's email with the attachments. It's already been made part of the record. That brings us to principal's report.
Good evening, I'm Eliza Pluta, the principal at Norris. I meant to bring the name tags this time, and they're on my desk. For the August enrollment, so far we have 472 students enrolled. We had 468 at the end of the last school year. There are 46 school of choice students included in that number in K-6. We have some new hires and some changes happening at Norris. Our new art teacher is Bonnie Ward. She's coming from Easthampton. Katie LaFond is our new music teacher, and she is coming from the Amherst Regional Public Schools. And our new assistant principal is Michelle Lukasiewicz, and she's been in Chicopee for several years as a teacher, a reading specialist, an interventionist, and an acting assistant principal and principal at times. Our ELL teacher, Maura Kornbluth, has been reassigned to the special ed position that was vacated.
So there is an ELL position posted right now. Denise Perkins is moving from 4th grade part-time to 5th grade ELA full-time. Sue White, our grade 4 half-time teacher, is going full-time in grade 4 to teach math. And Mr. Chamberlain, Brian Chamberlain, was last year assigned as a reading interventionist. However, he was reassigned to teach the Florida virtual remote model for the whole school year. And then that position, the reading intervention position, was cut. So he's been reassigned to a grade 5 classroom teacher. Some updates on our capital improvements that the town approved this at the annual town meeting. So far, our carpet installation began this week. So in all the grade 5, 6 classrooms, there's no carpeting right now. The doors have been ordered. It will be about 4 weeks before they come in. The shades for the cafeteria and the counseling suite, they've also been ordered. It takes approximately 4 to 5 weeks to come in, so they will not be installed prior to students returning, unfortunately. And then our sidewalks, we have estimates that were received, and then we put it out to the bidder, the first bidder that we chose, and then that person had a personal emergency, so now we had to move on to the next bidder. And then the structural and mason repair, the town ended up having to hire an engineer instead of contractors, so we had to push that off for a little bit. Some of these things are, we'd love to just spend the money July 1st when the fiscal year turns over, but there's a lot of backdoor stuff that has to kind of happen in order to proceed with these projects. So we always hope that the things would be done in the middle of the summer. However, they'll be done probably by the end of the fall. We had a great summer program this year. The grant-funded expanded summer school, we had invited 53 students to attend. 26 attended consistently. And then our special ed summer program, 25 were invited and 23 actually attended. So they were invited based on their IEPs. We also had about 25 more students who attended for services such as occupational therapy, physical therapy, speech services, and then reading tutoring. Other things that are happening, our custodians have been doing a really great job this summer, despite the heat and the humidity, trying to get the building ready and working around the summer program and working around the rug, the tearing up of the rugs. Our kindergarten Meet Your Teacher is going to be August 31st. However, we're going to be having a convocation this year, which is fantastic. So the timing of that is going to have to change, and we'll be reaching out to families soon about that. It will be that day, just earlier in the day probably. And then we are not, unfortunately, going to be having the ice cream social this year. Hopefully we'll be able to resume next year. That decision was made by the PTO and administrative team. And that's all for me. Thank you.
Questions? I have a couple. On the grade breakdown that you gave us up on top.
Yep.
Can you just give me the rundown of how many classrooms? That is, like, how many?
Sure.
Kindergarten?
Kindergarten, there are 4. Grade 1, there are 4. Grade 2, there are 3. Grade 3, there are 3. Grade 4, there are 3. Grade 5, there are 4. And grade 6, there are 3.
Okay. And then the mason repair, I believe I heard that the bids far exceeded the appropriation. So is it your thought that that's still going to happen this year? When you said it was going to be delayed, but you still think it's going to happen within the?
I'd have to check my notes on that. I'm sorry, I don't have.
All right. Dale? Okay. Thank you. Superintendent's report.
Thank you. Well, I've officially been on the job 5 weeks, and it's been great. Some challenging decisions clearly on our table, but everybody's been very wonderful and supportive and collaborative. And the central office staff have been slowly transitioning into their new roles. And we did hire a new administrative assistant that started on July 30th, Rachel Emerson, who's a high school para, and she's done a wonderful job. Communication has been a big goal of mine, and I've been holding individual meetings with all the administrators, all the principals, the business manager, curriculum director, technology director, special education director, all the central office staff, our legal counsel, as well as all the school committee chairs. And I did meet with the Easthampton Board of Health and our nurse leader as well. And I will still be meeting with the Worthington Superintendent, Gretchen, as well as our data specialist, who's not in the building right now. I've also had virtual meetings with the union representatives, and we're going to have individual meetings in mid to late August. And actually today, I did meet with our union representation here, which was wonderful. And we're meeting again on Thursday morning. And the high school has a joint labor committee that debriefs after the school committee meetings. And it was suggested that if the union representatives at the different schools wanted a debriefing meeting, we'd be happy to set that up. And that's not to question any school committee policies or actions. It's just to see how we can implement it and answer direct questions to help better support teachers as well. And so every month we are going to meet as a labor meeting, as a collective group as well. I will be meeting with local fire and police chiefs and town officials, and that's going to be between now and September as well. When new employees are hired, I do meet with them for a brief 10 minutes in my office just to say hello. I've met some new staff here at Norris, and they're wonderful hires, and it's just a way to open the door of communication, let them know that my door is always open, as well as just to make them feel more comfortable as well. I did attend the Massachusetts Association of School Superintendents Conference, July 6th through 8th, and I attended it virtually. And a lot of the focus was on social emotional learning and diversity, equity, and inclusion. So I'll be having those discussions with our staff as well. We are having an administrative retreat August 17th and 19th, and much of that focus is going to be on collaboration and teamwork. I realize that the team hasn't gotten together physically in over a year because of COVID, so that's going to be wonderful to just develop those relationships and have common language pertaining to evaluations and instruction. And we're going to be talking about professional development plans for the year, and a large focus will be on COVID protocols and safety procedures as well. As Eliza did mention, we are having a convocation for everybody on August 31st for the whole district at 2 o'clock, and a letter will go out to staff. And that's really to bring all the employees in all the schools together, just a chance to meet each other, see each other, share what our district goals are, introduce new people, and recognize some of the achievements of some of our staff. And we're going to have a new teacher orientation August 25th that we're going to be running as a district. In previous years, it's been done. Every building does their own new teacher orientation. But in order to save time, resources, and it's a big commitment for principals, district office is going to lead that with the help of Kim Florick, our IT person, Kate Mesmer in curriculum, and Nancy, and I'm going to butcher her last name, our special education director. And so I did share with you some of the COVID masking and safety protocols by agency. And some of these I've already shared since I drafted this a couple of weeks ago, but American Academy of Pediatrics does recommend that all individuals aged 2 and up should be wearing a mask indoors regardless of their vaccination status. The CDC did change their guidelines probably a week and a half ago. At first, they felt that fully vaccinated students and staff did not need to distance while eating, and they did not necessarily advocate for mask indoors, but they have since changed their direction with that. And DESE does recommend that use of vaccines is the primary mitigating strategy, social distance to the extent possible without setting minimum distance requirements, and that anybody ages 2 and up should wear a mask. It's strongly recommended, especially those who are unvaccinated in all grades. And contract tracing, quarantine protocols should still be used, but they restricted it to pool testing. And I did have an interesting workshop today with Stephanie Foss, our Director of Health Services, about testing options for the fall. And I will be sharing that more with you with Stephanie at our next meeting in September. But the basis, we have 3 testing options that are totally free. So they encourage all districts to just at least start having these conversations. That one is for any symptomatic student or adult. Even with one symptom, they could be tested. It's with the Bionax Now testing, and the results are within 15 minutes. It's just a swab in the cheek. The next one is if there is a case of a student or an adult in the building, instead of quarantining everybody would be tested for 5 days, and if the result is negative, they would stay in school. And the last is pool testing. So we are looking at the first two options. We want to explore more, so Stephanie has reached out to the state to get some clarification on some questions that she has. So when those become available, we will most certainly, we'll put that on the agenda for our next meeting as well. So that's pretty much all for the superintendent's report.
Any questions? And just for, I think questions related to interpretations or recommendations regarding opening school will come up under a
Yes.
separate line item on the agenda.
Do you have a timeline on when the pooled testing information will come along as far as being able to present to us with Stephanie? I know you just had the session today.
Yeah, we're hoping to present in September, and we'd like to take it slow with the first two before we jump right into pool testing. We've heard stories just from different committees, and we have some reservations, so we'd like our questions answered before we present the pool testing as an option to see what your choices are. But one of our big concerns was, one, who's going to do that, and it's a huge time commitment. The good news is the state did offer to pay for all of those options this school year, which is great news. And they did offer support through the CIC Health Organization. I don't know where they're gonna get all these volunteers, but they say that these people have been trained and they'd be willing to help us out as well. So hopefully I'll know something more by the next one, and then you guys can ponder some of those.
Do you envision
choices.
that particular conversation happening at an all-school committee meeting with all 5 committees together
Yes.
at once?
Yeah, that'd
Instead
be
of
great, yeah.
over?
But from what I've gathered so far from administrators and Stephanie's, we'd like to pursue the first two, the symptomatic and the quarantining and pool testing. We see down the road if we go that route, only because our levels here are low as far as people who have tested positive. It's a big time commitment, and you have to have everybody test. So if we don't have buy-in from either teachers or some families, or let's say 10 students are absent that day because they're homesick, well, those are the ones we really want to test to see where they stand. So we just need to explore that a bit further, but yes, absolutely.
Okay. Other questions? Okay. Next, I don't believe we're past the transfer period of time for the 21 budget.
Yes, and Bobby is on vacation this week, so I told her please not to worry about this meeting. She has nothing to present, and she'll give you a full report at the next meeting as well. But, right, there's nothing, I wasn't given any warrants or any transfers or any budget updates.
And then we still have the $500,000 deficit to deal with.
Yes, we
within
do
us,
have that.
But we had committed prior to the pandemic to get Bobby on a quarterly rotation and not a monthly rotation. So if that's still plausible, we recognize her limited resources.
Yeah, I think that's wonderful, and she'll greatly appreciate that.
I thought we did have 2 warrants emailed to us.
We got the warrants, just the end-of-year payroll warrant signature and that, but this would be additional cuts or staff adjustments that were out, because we gave quite a bit of leeway. Is there anything you want to add or update?
No, I wasn't sure where you were going, so I was waiting to say anything, but I just want you to know that, that deficit, is there, and you've gave me the leeway, like you said. We hired a music teacher, we won't be hiring a librarian, so that was cut instead of music. And I've been in constant communication with Bobby every time I'm making hiring someone or reassigning someone about how much does it cost, how much are we saving, where can we put the money, make sure we're within the guidelines of that cut, so that we make that cut altogether, just so you know.
Okay. All right, reports of committee. Hampshire Regional School Committee met last month. It was a reorganizational meeting, and the vast majority of it was conducted in an executive session on a matter that'll come out later on, so I really don't have anything else to add, except for Margaret Larson was reelected chair of Hampshire Regional. Collaborative?
The collaborative will be meeting in September. They haven't met over the summer. They did send out a update on, graduations and different things happening within the collaborative. There was a couple news articles about an audit that will be addressed at the next board meeting. But they are already working to, fix and make sure all the licensing for the teachers and the waivers, I think there was an issue with some waivers that hadn't come through yet. So they are working on remediating the items found in their audit. And we'll be talking about that at the September meeting.
Okay. PTO?
Because it's summer, they haven't met, but I did reach out to them, and they will be meeting September 14th at 6:30.
School council?
School council has been in recess for the summer. We'll begin meeting again in the fall.
Okay. 5-district committee, we still have the draft of the all-district committee that we got the last update on June 2nd. I would imagine that probably the window is closed for all the feedback from all the committees, and there might be a pending meeting or updated material coming forward for us to consider. Okay. I will just say that the feedback that we got from all the other committees is I don't believe the cost allocation, I believe there was only one other community that thought that was favorable or possible, so that's probably not going to happen. So the other approach for us will be to go with the weighted representation to avoid the taxation without representation that currently exists in Southampton. I believe Francine is our Board of Selectmen representative. This is your moment to share anything with the committee that you'd like to, or not.
Yes, this is not my first experience with the North School Committee. I was the liaison from the Finance Committee a number of years ago, so all your faces are all new to me, but the issues of the school obviously come up at the select board meeting, so that's how we stay on top. I'm glad to be back, and I appreciate everything everyone went through over the last, 18 months now? I mean, just trying to keep things together, and I really congratulate everyone on the job well done under the worst of circumstances that I never would have imagined. So thank you for that. Appreciate everything everyone is doing, and we'll help in any way we can for this coming year and beyond. I know it's going to be difficult. I know your resources are limited. We'll do what we can. And so I know I'll hear more as the meetings go on over the course of the year. And as I said, if there's anything that I can do to support, I will. Thank you.
Thank you.
And we're not double teaming you, it just happened to be this way. Okay.
And next we have the association. Would you like to?
No, I was just gonna say we're gonna be super quick.
Yes, we're going to be quick because we just want to do a quick check-in because we know that we're also later on in the agenda. So we just wanted to say hello as we start a new school year. Elizabeth Cawley and Susan Hale, members of the Executive Board of the Southampton Teachers Association. And just to remind you, we have each year about 70 to 75 members at Norris School. We represent all teachers, all paras, and all secretaries and custodians. So it covers everyone except the 2 administrators and the cafeteria. So when you see us throughout the school year, we are representing the whole body, and we just want to point that out, that we bring you concerns from everyone.
And the only other update we had was that we met with Superintendent Bonneville and Principal Pluta today, and like the superintendent mentioned, we're meeting with her again tomorrow.
Okay, thank you. Old business, review of current masking requirements and potential modification. The policy that we left the school in to start summer school is that if children are in the building, everyone is to wear a mask unless a minimum of 6 feet of separation can be maintained. So that was the last vote, or the last policy from us. And envision we'll now have a lengthy discussion.
Yes, so I'd like to hand out something to you. In the packets that I distributed were the DESE guidelines as well, and as well as the Mass Association of School Committees, their suggested policy. So I've been working with administrators on like a rough draft policy because we'd like to be consistent across. First, we were thinking at least all elementary schools, and now it's kind of looking K through 12, but the secondary I'll keep separate for right now. So I'm going to hand out, there might be some extras for you guys, I'm not sure, I only made 14 copies. And I'd be happy to read this out loud. This combines what we were thinking about as well as language that the Mass Association for School Committees suggests as well. So and I completely respect people's family choice and responsibility to be good decision makers. I completely respect that. However, I'm going to read this, but I also have some feedback from Stephanie Foss, which I will share when I'm done just reading this draft for anybody who doesn't have that. So our district's primary objective is to provide a safe educational environment for students and staff while keeping as many students as possible in school buildings and engaged in productive in-person learning during the ongoing COVID pandemic. The following health and safety protocols were developed in accordance with guidance and recommendations from the CDC, AAP, Mass Department of Public Health, DESE, and DESE. These protocols may be adjusted as necessary as new evidence is received regarding best practice guidelines, but will remain in place until further notice. Remember, this is just what I wrote. This is up for discussion, but I just thought I'd get the ball rolling. So according to public health experts, one of the best ways to stop the spread of the coronavirus and to keep members of our school community safe is the use of face masks. Out of an abundance of caution during this time of unstable infection rates, we will require all individuals in school buildings and on school transportation to wear a mask that covers the nose and mouth while inside school buildings. So in an effort to ensure the safety, it's our policy that masks are required indoors for all students and adults, including educators, staff, visitors, and volunteers, regardless of vaccination status. Masks will be required while utilizing school transportation. Masks will not be required outdoors in PE classes or while eating. Exceptions to the mask requirement and recommendations can be made for those whom compliance is not possible due to documented medical conditions or behavioral needs. A written note from a physician is required and will be approved by the principal in consultation with the nurse. Parents and caregivers cannot excuse their child from the face mask requirement by signing a waiver. Students are going to be supported in their individual circumstances and developmental levels in order to comply with mask wearing. Face shields or physical barriers may also provide an alternative in some instances, and individuals can be excused from the requirement per CDC guidance if they have trouble breathing, are unconscious, incapacitated, or cannot remove the mask without assistance. And so this last thing is I highlighted in yellow, but you can't see that it's in yellow, but while it's strongly recommended that everyone wear masks when students are not in attendance, masks will be optional for fully vaccinated adults at professional development or staff meetings. So I just want to explain a few things that Stephanie said, and then this optional one, I'm really torn because I totally believe in the safety of everybody, but I also believe in the freedom of choice for those that are vaccinated. I think anybody who's unvaccinated should always be wearing a mask, but when we talk today, it's kind of up for a decision. And I think as administrators, and even with Stephanie Foss, we kind of go back and forth. These are very tough decisions to make, and the changing guidance, and we still might get additional guidance from DESE, but when we've met with just local health officials, this is the best guidance that we can come up with. But I'm going to share with you some thoughts from Stephanie. Let me see, where did I write it?
And just those that may not know Stephanie by first name, her position in the district is?
She's our health coordinator, our nurse health coordinator. Let's see. Well, I know she sent us an email today, and I have to pull up really quick, but I know that the Board of Health mandates the wearing of masks in public indoor spaces in the city of Northampton. She's really concerned about our most vulnerable population not being vaccinated as well, and that masks and vaccination is really what all of our organizations really stress to us for best mitigating strategies. And we would still continue with hand hygiene, outdoor mask breaks, just the best practices, our cleaning protocols, and when we met with the union today, we were kind of thinking about what those practices would look like, and we think the way the schools left off in the spring is pretty much where we would start. And once kids were able to be vaccinated, then we could re-examine this, or we can actually re-examine it more frequently than that. Clearly, it's gonna be a hot topic for months to come, but we would like to start off strong so we keep everybody safe. The last thing that I wanna see is an outbreak on school in the first week of school where we have to worry about quarantining, isolation rooms, and having students miss school. The state does mandate that we are in school 5 days a week, and God forbid if we have some kind of an outbreak, if we do have to go remote or shut down, we would need special permission from DESE to do so, and they wouldn't necessarily count those remote days as time on learning. So they've made that very clear that 5 days a week for everybody. Anything short of that is not an option. So we believe that if we start off strong, and then as numbers of vaccinated people increase, then we could perhaps lessen if there are no outbreaks in the town. But I'm very curious to know what your thoughts and recommendations are.
I have a couple questions, just clarification. Physical education classes, is that both inside and outside?
So this is interesting. So DESE, the physical education classes was a Mass Association of School Committee. That phrase was in their policy. DESE does not reference that. They just say outdoors and lunch, no masks are required. They don't specify PE classes, but we feel, especially if students are running around, it's not like they're gonna be wrestling in PE class. I think our PE teachers are competent and know that they're gonna socially distance as much as possible, and we would clearly be outside as much as possible. So that was one thing, and another thing that I wanted to mention. Yeah, and I'm not sure how you feel about, we believe that although teachers are vaccinated, and while I completely respect choice, when we've done surveys, and I've got the results from the Southampton Teachers Association results in here, most do support face masks for students and teachers. And I've seen reports from, or word I should say, from Westhampton, Chesterfield, Goshen, and likewise, they support. So we'd like to, whatever we decide, we would like it to be across the board, across all elementary schools, just for consistency within the district. And so it's that last one, teachers wearing masks when students are not in attendance. That mask would be optional. So that one's just a giant question mark.
Right, so from a liability standpoint, have you collected and verified proof of vaccination? Or is it the honor system?
Yeah, you're right. So it is the honor system. Teachers did have reported, if they feel comfortable, do so. But I do believe that vaccination records are public records. So Stephanie would have access, like you and I couldn't access those records, but there's medical databases.
Well, there's a ruling from the Mass Supreme Court that in this particular case, an employer has the right to request it, but you have to do it in a certain way. But I'm assuming the district hasn't done that. So I guess to me, that sounds of, we're going back to asking people for papers, which is a period in time that I don't particularly care for. So it's, everyone wears, you just assume it's not, and if you start making exceptions, if we're gonna go down this road, it's just mask all the time. I also, just some feedback from last night's Board of Health meeting. So you've already answered some of their questions because they suggested testing, where now the state's picking that up. So I said I would get your feedback on that. You've already given that to us. One of the concerns that we had last night, Julianne and myself attended the Board of Health meeting, was that this is our last meeting, subject to special meeting, before school opens. So if the school committee doesn't change its policy tonight, it stays the way it is until September 8th when we meet again, or we have a special meeting. I think whatever policy we come up with is gonna be fluid and probably needs to just stay on the agenda every month to be revisited, and not just kind of set and forget it. But This brings me back to the classroom numbers. Based on those numbers, like first grade, 4 classrooms, some of the guidance in here says a minimum of 3 feet. I believe, it's been so long, I don't remember what numbers work for us and which ones don't.
3.
Does the minimum of 3 feet with that classroom to student ratio work currently with everybody in
3
5
feet
days a
would
week?
work with everybody.
Across the board?
Yeah.
Right, and while DESI doesn't list a specific distance requirement, I think we're all agreed that we distance as much as possible. And lunch, they give no guidance about lunch. So I think we've agreed we're gonna try to distance as much as possible during lunch and not have students be on top of each other. And today we talked about if students are doing group work, to please be mindful of close contacts, not to have students sit close together, to spread out. But we would like a return to normalcy. Things that were in the spring, but I think we can ease up on things just as, when we're walking down the halls, no longer is the requirement in place that you have to be 6 feet apart. I think we need to use common sense and not be on top of each other walking down the halls, but all the arrows have been lifted off the ground and so forth. But I think really,
And where we left off on the PPE stuff, or the PPP stuff, the shields, we still have at least one shield in every classroom?
Yes, plexiglass, yes. I think some teachers returned it at the end of the school year, but we do still have it in the building in order to, if they want it, they can have it.
Okay, and then could we, this was one of the other issues, younger grades, it was mentioned by at least 2 people tonight, you know, the phonetics or phonics, you know, and so I think, and maybe in your version, it's already stated in there, so I would just give the feedback and see if it needs to be clarified, but I think if, especially with dealing on one-on-one ratios or a 1-to-2 ratio, and the shields are available, and you can maintain more than 6 feet, you know, beyond the 3, that in that isolated instance that the mask be able to be removed, if you're looking through the shield, so that the kindergartens and the first graders that need the phonics, need to see the lips move, are able to do that.
Like, I look at that as like my classroom. I had to do that with my 20 kids. So it wasn't a one-on-one, it wasn't a small group situation. They had no idea if I was saying M says or N says N unless I pulled it down and fully showed them. And they couldn't mimic it back to me. So I personally don't agree with the younger ones. I get it, and I know the importance of masks. I'm not downplaying that part, but I feel like we're really hindering on their phonics, their pronunciations, their emotional cues. We took on second steps at Norris. I teach that at my school as well. And the whole first, at least 10 weeks of it in preschool is all about, look at this boy's face. He's looking down. His head's like, look at his eyes, look at his mouth. We can't do that with a mask on our face. So I feel like we're hindering a lot. Social, emotional, phonetic, everything.
teaching that outside, and I know I have hearing aids, so it's very hard for me when people are wearing masks to fully understand what's going on. Oh, I agree.
We do have the tents up, so my hope is that we'll have group settings outside and some outdoor learning while the weather cooperates. So I think if we use the plexiglass barriers, a teacher could stand behind and have that as their physical barrier to show, the facial expressions and the phonics and the sounds. But
I just feel like it's not teaching them emotion. It's robotic. It's becoming where they don't even understand it at this point. And it's going to affect them as they get older. I mean, how many more years can we keep going? We have, I think, 9 cases right now in this town. If we had 1 million cases, not 1 million, but if it was a higher number, I'd be totally all on board for it.
Well,
But with 9 cases,
as of last night, it was 5 confirmed and 2
so even smaller,
suspicious.
out of a town of over 6,000, that's, to me, that could be one family. I mean, it probably isn't, but
We sorry, we can't go back and forth. Other thoughts, comments?
As far as the Board of Health's mask mandate order, as far as I'm understanding that applies to within the school building, because the school is one of the public buildings. So while
Correctly
there's a
told us
question
no.
about their ability to make policy, and it's the school committee's jurisdiction to make policy, as the Board of Health can make policy regarding public health, indoor space. So they have that mask mandate in place, wouldn't that cover the schools?
According to Ms. Rooks, no, that she cannot mandate in school. They have to follow DESI, CDC, and recommendations of the superintendent.
Are you referring to the email that Charlie Kinnicky answered?
That one, and she was writing private messages as well.
So I can't talk to that.
Right.
But the specific question that Charlie was asked isn't this question. He was asked whether or not the Board of Health had the authorization to step in and override DESI on the reopening plan. And that answer is no, they didn't.
That's not accurate.
Well, we can pull up the email and read what the question was.
Right, the question is not on.
Point of order. We're not in public comment,
Sorry,
so we have
we're out
to
of order.
limit public comment.
As far as busing goes, there's a separate regulation that even trumps the Board of
They
Health.
have to wear masks.
Right, it's mask on the busing, period.
I think we have to stay strong. I think our kids are used to doing this. If there were 0 cases in town and we're looking at numbers like we were looking at 6 weeks or 8 weeks ago, this would be a different discussion. But over the course of 1 or 2 weeks, we've gone from 0 cases to 7 cases, or 9 cases. I think it's 9.5 per 100,000. I mean, this is something that's rapidly increasing, and if we look at every community around us and what they've put in place for their schools, I think we need to start off strong on this and find ways to do what we can do to get kids the phonics using outdoor spaces and using the physical barriers. But I think we also need to keep them safe and out of the PICU and keep their families safe, because right now this variant is still very much a threat even for the pediatric population.
I find it really sad, though, that we even say the kids are used to it, because they shouldn't be. No child should be used to have to be used, I'm just worded that really bad, to wearing a mask all day, ever. That should be a nurse, a doctor, a physician. A child should not have to wear a mask every day, all day in their classroom.
Yeah, I don't think
And
anyone
they
wanted
are
the
used to it.
pandemic.
My kid comes home from school and forgets it's still on his face sometimes, and I have to tell him to take it off. So, yeah, he's one of the kids who is comfortable. He's not one of the ones who's chewing on it. But then that's a problem too. That affects their everything, their emotions, their anything. The fact that they're getting used to having a mask on all the time, that's a problem in itself.
Yeah, I agree, and unfortunately, there's no easy answer. It does stink.
And I do think that there needs to be something with masks, especially just now going back after vacations and camps and all that. But I wouldn't see it as this strict where masks are on all day. I could see like a compromise of some sort where if they're in the classroom, they're sitting at their desk, it can be off. If they're in a small group or at circle time or walking in the hall or going to the bathroom, they're back on. Like transitions, things like that. But they're with the same group of the biggest classes, 20-something? And they're with those same kids and that same teacher all day. If the teacher's not comfortable, or if some of the kids aren't comfortable, put it on. But if they're sitting at their own desk.
So the school day is 6 hours, right?
6 1/4.
And
And then the bus.
an hour of that is unmasked because they're eating or at recess,
Or a mask break.
or a mask break. So the mask time of a child's day is less than 25%, right? Because it seems like, a lot of people are gonna let their child relax that. Like, there aren't many families that I've heard of that mask at home. And I think that's a little overkill, but it seems like it's less than 25% of their day. There are other outlets other than school to do social emotional learning. And there are creative ways to mitigate some of those things, like, that's more the nitty-gritty for the teachers and administration to decide, but there are strategies that one can use in order to address some of those concerns. So I encourage those to be explored. You know, the recommendations from all of those professionals for which it is their expertise, they're saying, this is what I think you guys should do. And I don't feel comfortable overruling them at this juncture. Think that it's prudent to follow their guidance. That's why they issue guidance, is because they think that's the right thing to do. That's the way it's done across the board in medical communities, right? People issue guidance based on their medical expertise, and then it's not 100% followed, but I rather go to a physician that follows guidance, or rather us have a school that follows guidance of professionals that have made this their professional venture, rather than overruling those people in favor of other ideas. I don't think that that's very prudent.
There's not much to say even on the fact of what about depression alone, and I know that is your career, basically. I mean, we just lost a 5th grade student, 5th grade, and they took their life because of exactly this. They're suffering depression. They're sick of not being able to see their friends. They're sick of not being able to socially connect with other people. 5th grade, taking their life. But we just keep pushing it. No one's looking at that at all.
I think that there's definitely some things that can and should be done to address situations like that, or some of the other situations that we mentioned. I think that's why the draft policy is looking at exceptions. And that's something that can be discussed with family providers who...
Only if you know they're depressed. If you have no idea, I mean, do you know how many kids come home happy as can be? Well, you think they are and they're not. I mean, you do know that. It's not always that easy to see. I lost a family member to suicide as well. No one had any clue he was suffering. So no, we couldn't have had an exception or talked to a physician about it because no one even knew that was the case.
The draft of the policy here that you have before us is drafted August 10th. Are we the first committee to see it? Has this been approved or adopted by any of the other committees yet?
Well, I've presented this to Chesterfield Goshen. It's kind of been reworked on a daily basis.
Okay.
But at that meeting, I presented that all students wear masks and that it was optional for teachers, and teachers weren't in support of that. They wanted everybody to be masked, just with the Delta variant, and that people who are vaccinated are still getting sick, and it was just really to protect everybody. So, and then that shortly came right after, on the heels of when I met with Easthampton Board of Health. Tom Martin, just met with him as an individual, not in his official capacity, with Margaret and Lauren at the high school, just to get his point of view. He thought it just made good practice as well. But trust me, every day I go back and forth, and it does weigh heavy on my heart, because you're right, it is horrible for kids, and I think about like graduating seniors, what that's for them, but unfortunately, we're dealt the hand of a global pandemic, and we have to make the best of the situation. I think it is important, like Austin said, to explore different instructional strategies, because it is important for teachers to be able to teach phonics and speech to students without wearing a mask. You can't learn a different language when you have a mask on. But I think those are some things that we can overcome by just doing some research and collaborating with one another and seeing what works and doesn't work. And this is not a forever policy. I think this is just for right now, and I think this needs to be revisited every month to see if things have changed and if we can loosen.
Well, and so that's one reason why I would tentatively support this tonight, because school starts on the 1st, we meet on the 8th, versus going a weekend with no mask, and then on the 8th being given new data saying, oh, now we gotta do it, and Alfler, and so we're talking about a 1-week span. And I get it, I get it, you know, views are high on both ends of this, but before it's back before the body to look at. This particular policy, I don't think can be set for the year. I think it needs to be tweaked as we go along. And I meant to get an email out before today, but I didn't. You know, I'd like to bring back the inventory list. You know, this is what we want to have on hand, minimum, and this is what we currently have on hand, so we can see, you know, how much of the protective equipment do we have? You know, did 2 shields get broken? Oh, that's okay, because we have 3 in reserve, now we only have 1, and we have time to order. Because I think as this goes up, what's going to happen, and you're already seeing it, if you're attempting to buy masks now, the inventory's not out there. So, I do know the good side is over on the town side here in Southampton, we were told last night we have ample inventory. So if we have to borrow from Peter to pay Paul, we can do that, but we should have that out. Possibly looking at what Superintendent Sullivan did for the weekly update with Stephanie, the numbers. I would like some guidance from, well, I'll pause on that for a second. You stay to the end of the Board of Health meeting, Julie. Did they set a regular scheduled meeting?
They did not. No, I left shortly after you.
Okay, so I'll reach out to them, but one of the things they were gonna do is have a standing monthly meeting time, and then yourself as superintendent, Stephanie and myself would have the first spot on the agenda. In the event that we need to talk about something or work something out, there'll be a standing monthly meeting to address that as the numbers change, so we don't have to try and
Great.
hurry to call meetings together. But I think it's important that whatever metrics you opt to use, and they may be the same as Superintendent Sullivan, or you may put your own mark on them, you know, with your team, that, you know, by the next meeting on September 8th, we see what that is. And then especially within Norris, we communicate that out. You know, here's what it is. 0 cases in a rolling 14-day. We drop the mask, whatever it is. We communicate that out to the parents as well. And then every Friday, there's a wonderful email blast system that Norris can do. We just constantly get this information out to everybody. And they'll know. Hey, the school committee's not gonna change this policy unless we get below X, and we're twice that number. Or we're below it. Then, as we did last year, when we set the metrics and we met it, we rolled things back. And, you know, this school committee, which is all the same, except for Mr. Bennett who left, who moved out of town, everyone's goal on this was to get the kids back into school as safely and as quickly as possible. And I think that we stand by that this year as well. But if I vote in favor of this, I want it on the agenda every month to look at. I don't want it to just sit there. And that means a 1-week period with masks for the start of school.
And I think we need to be pretty, understand this is all fluid. Metrics may fluidly change, this may fluidly change, because we don't know what may be coming next. So it could go backwards, it could go forwards, as far as relaxing or strengthening our layered approach, but I think we need to have the layered approach to continue and start the year. I agree that we don't need to have the strict 6-foot marching like we're doing. We could go to 3 feet, but, use our best judgment on that. I think we need to stay with masks right now. As far as the last comment here, the CDC had originally said vaccinated people didn't need to wear indoor masks, but that has all changed with the Delta variant because of all of the studies on Provincetown, on the Cape, of how many, persons were positive and transmitting even if they were vaccinated. So with the Delta variant, it is different, where this variant will transmit even if you're vaccinated. It will prevent, you're less likely to be hospitalized, hopefully, and die, but you can still transmit, and perhaps it may result in a lethal transmission to someone else who might be immunocompromised. So we need to, I think about that last statement, and if we want to keep the schools staffed, we want to protect our staff. I think if they're having professional development and meetings indoors, and they're not among household members, I think they need to be masked, even if they're vaccinated. If they want to hold their meetings outdoors, great. Then I think they don't need to have their mask on outdoors if they're having some space and some air. But I think we want to keep our school staffed so we keep the kids there. So we want to protect our teachers.
See, and I feel that makes a lot of people who aren't vaccinated yet not want to bother getting it. And I've heard it from, I'm vaccinated, I'm for it, so I'm not saying that. But we were told last year as teachers, and at least at my school, maybe not at Norris, But they were like, oh, get vaccinated, then we won't have to teach with masks on. And same thing with other doctors, then you won't have to always wear your mask. And now it's like, oh, you're vaccinated, but you still need to wear your mask everywhere you go. So it's not encouraging people who haven't gotten vaccinated yet to get it or to want it for their child.
I think everything's changing. We didn't know what this Delta variant would bring. So this variant
But we
is
don't know what
1,000
else it's gonna bring
times,
either, so it.
yeah, 1,000 times more viral load in the nasal passages than previous variants, and is probably the most infectious virus we've ever seen.
I'm not downplaying the virus, trust me, I think it's horrible. But I also am picturing a little kid with a wet mask, a dirty mask.
Right.
When they're at recess, they're wearing it around their neck, getting full of dirt and germs, and then putting it back on their face. So how's that protecting anything? It's giving you other things right in your mouth,
Well, I think,
especially the way they wear it at recess.
So, that's a valid point. So can we look into possibly the district taking on the responsibility of swapping out masks halfway through the day? I mean, the parents are sending them in, right, because they're required to send them in, but have them available.
We have them available
For the younger
for kids. We have tons of them.
Yeah.
The one thing that I would take issue with the policy as it's written is the exception for PE when it's indoors, because two of the high-risk scenarios for transmission are going to be in PE and music, because that's when you're most likely to project any viruses that you may have. So I would want to see that change to outdoor PE rather than all of it.
Yeah, and it's interesting, that was a Mass Association of School Committee that they used that wording. Other agencies kind of left that blank, but I agree.
I wonder if it's off of like youth sports guidance. I wonder if that's what they were trying to go with, youth sports, but that's separate. Like youth sports is an optional, often, extracurricular. School is a public health, right, for everybody to get a free education. I think we need to be more strict.
So you might want to just strike physical education, because if it's.
Well, because it says outdoors,
If it's
so-
outdoor,
If it's outdoors,
you don't
you're
need
fine.
Yeah.
right. Having it in there causes a question, whether if you have the kids in the gym.
So in this draft, I took out in PE classes and the last bullet about teachers. And I understand where you're coming from with teacher choice. Then I was just thinking, finding substitute teachers was next to impossible last year. So if a teacher, even if they're vaccinated, isn't wearing a mask, and God forbid they get sick, we're looking at finding coverage 2-3 weeks, and, there just aren't subs available. So I think we have to do everything we can to keep our staffing situation as healthy as possible.
Are your PDs being done like in the cafeteria? Are they being done on Zoom?
Cafeteria. Which I will have everybody spread out. I won't, I'm not gonna have them
That's
sitting
why
right
I'm
next to each
That's
other.
why I was asking.
My hope is that we can take whatever policy we have and be walking it back all year, just like we did with the distancing last year. Most people probably remember my fight to walk that back. So that would be the goal here, is the data looks good and we're able to walk it back and, address all of the concerns that are being brought up. But right now, again, we're not doing COVID again, we're doing COVID anew, because it's a different variant, because the viral load is stronger, because transmission happens more easily. So we're doing it a whole new way, and I think we just need to see what happens, and then we can start walking things back as it looks good.
But then again, what is good? Because right now, 5 cases to me is pretty good. Do you know what I'm like? I do feel there should be some for it. Like, this to me is way too much.
We have to watch and see what happens.
But that's my point. So what is our setting ground?
What's the metrics?
Yeah, to me, this is way too much when we only have 5 cases in this population.
I think that's one of the complicating factors too, is last year, we thought that a 3% positivity rate was gonna be bad, and we went up to like 13 or something crazy. So we don't know what's bad and what's good until we're able to see more data points. So I think even now it's hard to set metrics, and also we have how many bodies advising us? 1, 2, 3, 4. So we have 4 different bodies that are gonna tell us and help us to interpret those metrics. And so we stand even better chance of taking the prudent yet non-preferential approach, because I have been lobbied by my oldest child to remove the masking requirement. You know, I think we're gonna take the prudent approach, or at least I'd like to, and then we have these bodies to tell us, all right, you're clear to go, remove the mask, start relaxing things, and take it from there.
So if we can pause here for a second, only because it's later on the agenda and it's kind of broad for the association to share their thoughts and potential concerns for the upcoming school year. Because I'm sensing a vote coming on the policy that's specifically related to masking that the association was going to bring up later. Is there anything you want us to hear prior to a vote or a call for a vote? Now, this is just on masking, and then we'll get into everything else later on the agenda.
Did you receive this? Okay. So we took a poll, and unfortunately, about half of our members participated. So that's, I think, important for you to know. So we had asked 2 questions about mask wearing. And the first question is, would you like to see all students and staff at Norris wear masks when they are indoors? And 65% of our group that participated said yes, and 32 said no. The question got edited while it first went out, so that's why it's like a little funny, the math there. And then the second question was, would you like vaccinated individuals to have the option to be unmasked when indoors for things like PD or staff meetings? And 60% said yes to have that choice, and 39% said no. So that is where,
Out of how many again? How many didn't participate?
about half of us participated. So I think those results are kind of interesting, because I feel like they're like a little reverse of each other, with majority saying, yes, I want everyone to be masked, but at the same time, yes, I want a choice for those vaccinated individuals to not have to wear one. So that's really the only results we were able to get from our members to bring to you in regards to masks.
Okay, thank you.
So I think just lastly, I can't pull up somewhere Dr. Bonneville wrote that we don't have the ability to enforce mask use. So even if families indicated their preference, that's not the teacher's job to enforce that. So if the kid pulls it down, it is what it is.
Meaning
that it seems like the teacher wouldn't be expected to say, hey, your mom and dad wanted you to wear a mask today, so you got to put it back on.
Well, I believe the policy would be, as written, you have to wear the mask.
Right.
It's the same, use the analogy, there's no smoking in school. If you do, there's a documented process you have to follow. If we say you have to wear this, if we set the policy, you have to wear it, and you don't, it follows the process, right? Just like any other violation of policy.
I'm talking about a mask optional scenario.
Right.
But
And an
even
optional.
in a full mask scenario, we might still have people that don't comply. So we would need some sort of documented process that's stronger than the one we have here tonight. But my point is that mask optional means essentially no masks, because I haven't met any kids that are pro-mask. So they're gonna pull it off and they're gonna leave it off, and the teachers won't be able to force them to put it back on. It's not their job, and I don't want them to do that. So, you know, I think it's kind of like a one or the other type thing. So, again, I think that we open a can of worms when we ask teachers to be in a classroom where there's expectations that some would wear them.
Right.
So you saying that tells me that you won't ever change this, like, this is you for the rest of the year then?
You have to listen to the words I'm saying, and
Which
not
I am.
interpret the words that I'm saying.
You just said that you would not feel comfortable putting that on a teacher. I wouldn't put that on a teacher ever either. But eventually, if we do go optional, it still shouldn't be on the teacher.
Right.
It should be on the parent to instill that, just like you're instilling on your child right now that you want them to wear the mask. So it should be instilled in however you feel in your household.
Right, but I also said that I want to walk this policy back over time. And I'd like to see that happen before the end of the year. So that's not what I'm saying. I'm just saying to start, it's a little bit tough ask.
Okay, so I think here we do have a pretty good policy with some changes, 2 changes, and then the rest of this policy, if we vote here, will you bring what we vote to other districts to try, you're
Yes.
hoping for a universal?
Yes.
Okay.
But if there's a vote of the body tonight, this becomes the policy for the Norris School. So the only other changes that I would make to your draft version is I would, off of the MASC version, is I would take the last 4 paragraphs. If students are in violation of this policy, the building principal will consult with the parent or guardian to determine whether an exception is appropriate, or the student may be removed from the school building for in-person learning until such time as they can comply with the requirement. Violations of this policy by staff will be handled in the same manner as other violations of the school committee policy. And visitors in violation of this policy will be denied entry into the school. Because we have the policy, we just don't say what happens in the event of a violation of the policy. And that's coming from,
So all the second page for the MASC policy, you
right,
want all of
just
that?
starting where if students are.
Okay.
And again, if whatever the final version of this policy is, goes out via the email blast, because another benefit of doing this tonight, 3 weeks before school starts, is it sends the communication. Versus last year, when I think decisions were being made 48 hours before school started.
Do we want to specify what type of masks? Like a 2-layer, I think last year it specified a 2-layer mask. That's one question I have for.
Yeah, I had met briefly with Stephanie today, and we discussed that too, because you can't have bandanas or the face gaiters, so I will include the language of the appropriate masks, whatever you guys had last year. I think that's a great suggestion.
Yeah, Stephanie did a one-pager PDF that went out, and if it needs to be tweaked at all.
Yeah, that's a great suggestion.
There's no other comments? The option is for somebody to make a motion to adopt this policy as presented, or no action tonight leaves the mask policy that we set just before summer school in place.
I'll make a motion to adopt this policy as we discussed with the changes of removing the language in physical education classes. And the last paragraph on page 1, while it is strongly recommended that everyone wear masks when students are not in attendance, masks will be optional for fully vaccinated adults at professional development staff meetings, so remove that language. And to add the language from the mask policy for the final
The last 4 paragraphs.
4 paragraphs, starting with if students.
With the caveat that this remain as an old business item for every
Yes.
school committee meeting.
Second.
There's a second. Discussion. All in favor? Aye. Opposed?
Nay.
Motion passes. Next on the agenda is a request for a joint meeting with the select board to fill a seat vacated by Greg Bennett. So we need to officially submit a letter to the town administrator requesting a joint session of the North School Committee and the Southampton Select Board to fill the seat that was failed to be elected by Mr. Bennett. And then I think if we can fire that off by next Wednesday, there might be an opening on August 24th meeting. Hold that joint session. Next, the association to share, so the topic says to share their thoughts and potential concerns for the upcoming school year. So this was the remaining item from our June meeting, I believe, where, going through the process, we agreed to come back together in August prior to the start of school to just kind of have an open dialogue.
All right. So I guess a quick question. We were sort of under the impression that there would be a special meeting in regards to COVID. So is this that special meeting? Or is there going to be another one?
Right now, this is the only one unless another one's called.
Okay.
Yep.
So if we, okay, never mind. Listening to tonight, I feel like a lot of our questions and concerns were heard or answered. So we don't have too much to bring forward. I already shared the survey questions in regards to the mask wearing, and I forgot. So we had one other question that we asked everyone that we felt was relevant to bring forth to you, which was, would you like to see social distance measures when indoors? For example, 6 feet in classrooms, lunch and snack distance, or distance in bathrooms. And that was pretty much 50-50. It was 48.3 were in favor of 6 feet of distance, and 51.7 was opposed, but we didn't get into specifics of like, is it just because of the 6 feet? So one of our questions is, do we have a distance policy that we will be following in our classrooms?
So, again, so the last policy we left off on, because we didn't change that one, no, we did, right? We said,
We went down to 3. We went with the guidance of DESI.
right, so we're at the 3 mark right now. DESI is still suggesting 3 feet wherever possible.
In terms of setting up our classrooms, that is just a big question of, do certain classrooms return to tables where there could be 3 to 4 kids facing each other, or do we have to be distanced? So what I'm hearing is it sounds like 3 feet of distance between all students and staff.
Yeah, unless would it be your request for us to think of a higher number?
I actually think that teachers are wanting to resume small group activities if it is 15 minutes or less to reduce exposure. We feel like it's really important with our new reading curriculum to have small group reading times, working one-on-one, close with students.
We were told DESI approved that small groups can happen.
So we were just wondering, because
As long
it
as they're
was
short spans of time, like you just said.
right. So I guess where does that fall if we're being asked to have our students 3 feet apart? Do our small groups have to be 3 feet apart? That's what we're wondering.
If it's less than 15 minutes and we're wearing masks and our numbers are looking okay, I mean, it could all change. Do our numbers explode like the winter? We might have to change it.
Mm-hmm.
But I think we have to keep an eye on what's happening in our community. And if it's less than 15 minutes and we're masked, I feel like we can relax on,
Yeah.
I think trying to maintain it when you can, but for small group settings, I'm feeling like we can relax some of this distancing.
Right, and that's the current position, right, Elisa, it's 3 feet when possible,
Right.
right? So, yeah, and I think if we keep that policy, administration can always strengthen it if need be on the spot. It doesn't have to come back to us. So if something was happening and Dr. Bonneville or Elisa or Ms. Pluta made the decision, you know what, we have to go 5 feet, then they just do it, and then we get informed afterwards about it. It would just be going below the 3 feet on a permanent basis. That would go against policy, right?
Correct.
Is that-
I think that, we need to appreciate a little bit the fact that the teachers are wanting to continue with small group instruction because they know how important it is, and they know that for the last 18 months, we were not able to do that. And I think that DESI hasn't said that we have to continue with desks and rows and all students facing forward like we were before. That does scare me a little bit, but at the same time, we're gonna be masked. They're all gonna be masked, and 3 feet for the most part, unless it's,
I wouldn't spend all day spaced like 2 feet from each other facing another child across from each other, but I think in small bursts, so.
We were told we could go back to seating in any
Right.
direction as long as we tried to keep the 3 feet.
And we're still gonna spend the extra $40,000 to keep the MERV filters
Yes.
running
Yep.
24/7, right? Yeah.
This will be the third time we change them, right before school starts.
Okay. And then the only other question that we have for you is, will we have access to PPE and cleaning supplies like what was made possible last year? And to go with that was also the MERV 13 filters, so thanks for answering that. But will we have access to masks for students and staff if they break or unforeseen circumstances happen? Will we have the same cleaning wipes that we had last year, and gloves and things like that?
Right. So our intent would be yes. As a committee member, I can't promise that right now until I see the inventory list.
Okay.
But
Right.
I think we're working, we want to maintain at least what we had last year, and where we're going to deviate, we're going to talk about it. An example of a deviation that we are going to talk about is busing, as an example.
Okay.
So if we are going to make a change, there's going to be a discussion about it before the change just happens.
Okay.
So on the cleaning protocols and all that, are we still running with the additional halftime custodian?
No,
Okay, so is that going to be an
We
issue,
don't have-
potentially impact
right.
not being able to do what we did last year to the level that we did?
Well, at the end, it's very hard to say. I don't have money to
Right.
hire an additional custodian. That was part of the COVID, the CARES Act money. But I think that when we found out March, April, that the guidance was saying that it wasn't transferred from tables and passing of papers and things like that, we kind of, eased up a little bit on the cleaning. I mean, the custodians were still very busy in cleaning and everything, but we weren't doing the deep cleaning like we were, previously on Wednesdays. We were doing cleaning after school when everybody left and in between the 2 preschool classes. So we are planning to do the same thing, and we would be able to do that with the staff that we have now.
Okay. So I just, a side note, because it came out last week, the select board's looking for all potential uses of the ARP money that's in over the next 4 years. And that particular position, because it's cleaning and it's related to COVID, would potentially qualify. So I don't know
That's the
where
American
you guys,
Recovery money? Okay.
where you guys are on your list of requests that I think is due next week. I think it came out while you're on vacation. So it's on the item.
Okay.
But, so I guess think about that, where, other things that may have gone by the side because of financial, but are strictly related to COVID, that really seem to be low, cheap money, I guess I would say, right? mean,
I didn't
we're dealing
realize there
with-
was a blanket statement to Norris School asking us if we had
It went out to all
any
department
costs.
heads.
Okay.
I know your spot was on there, and I think we need to, that's something else on the town side that we probably need to address, that whenever they send it to you, they should send it to Dr. Bonneville as well.
Right, and Bobby Jones, the business manager, would, yep.
Sorry, I got off track. Go ahead.
That's okay. That's all that we have to present tonight. I think there's a lot of feelings that in the next couple of weeks, many things could change. So I have a feeling there's a chance that we might request for a special meeting or,
Yep.
and that's what I was gonna ask.
Yeah, I'm completely open to it. We got to meet the 48-hour rule.
Yep.
So if you could give me 3 business days at least.
Yep.
On when you want to do it, and coordinate schedules, but I think the committee's going to be flexible. If we need to meet, send the email, here's what we're seeing, this is why we think we need to meet.
Yep.
And
Okay.
then we can get it on the books.
And last year, Austin and I went and did that
Yeah.
lunch thing, if we want to do a brown bag. I thought that was great, going
That was great.
and meeting. I don't know if we want to do that again.
I think absolutely. People definitely enjoyed that.
See 2 of us go.
Yeah. That'd be great. All right, thank you.
Thank you. think we've already covered the report of the August 10th meeting from the Board of Health. Review any restrictions held over from end of last year related to COVID, and if the committee wished to keep any in place. My memory might be off here, but I thought we left busing at the 1 mile radius.
Yep.
Okay, so does administration have any suggestions for us, or no? I think, I would, while you ponder your thoughts, I'd like to maintain the window ventilations on the bus, even as we continue the capacity, and make sure that Durham understands that we need to do that. We do not currently have a monitor on every bus, correct?
Correct.
Okay. And at the 1 mile radius right now, at least on last year's numbers, at the 1 mile radius for those that participated, the buses were running at about 50% capacity? Except for maybe the one bus going out to the ponds.
Right, yep.
And that particular
A little more
bus-
than 50, I would say.
All right, and that particular bus has the school choice bus stop on it, which potentially drives up that number? We-
Yes,
we
but I
added-
thought we were not transporting school of choice students last year.
Right, but this year we are. We approved
Okay.
the stop in the
Hampton Ponds
the
Plaza.
shopping
Oh, okay, I
plaza.
forgot about that, okay.
So I know, it didn't come up tonight, but it's, the backup on the college highway is going to come up. So prior to the pandemic, Dr. Bonneville, we were at a 0 mile radius. You could live across the street, we picked you up, potentially. So we had to go to 2 mile in order to meet, because we couldn't get any extra buses. And then we were able to drop it down to the 1 because people still opted not to participate on the bus. So
Now there's
we're
no,
starting in 3 weeks.
there's no guidance, we don't have to have capacity
We could go all the way
limits.
down to 0,
Okay.
but again, we're putting masks in to take slow steps. I don't know about dropping it all the way down to 0.
Mhm.
So I don't know if the recommendation is to stay where we are and see how the first week plays out, or what the initial thoughts are, or if you guys want to get back to us.
So it would either be, we go down to 0, everybody gets picked up like they were before, and everybody has a mask on the bus for potentially 15 minutes or more, right? So the kids that live within a mile are gonna be dropped off quickly and won't be on the bus for 15 minutes.
Or do we go to 3/4 mile and see what that impact is? We have a smaller population,
Right.
student body, so I don't know if Mickey has had a chance to run all the numbers with Durham.
Yeah, but I did hear today that Durham is not putting any students on the bus that did not take the bus last year. That we're gonna have to, I just heard this late this afternoon, that we will have to reach out to parents to find out if they plan on sending their child on the bus, and then we have to add them. Because if they never took the bus last year, then they're not on the bus list, basically.
Gotcha.
So I'll have to work on that.
So you're not at a spot where you can tell us this because you don't have that data point. You
Right.
don't know how many kids, how many parents want the bus service.
Right.
Okay, so probably over the next 2 weeks. So do you want, well, if we don't do anything tonight, you're staying at the 1 mile radius.
Correct.
You feel comfortable staying at that?
I feel comfortable staying at 1. I mean, I'd love to get rid of that parent pickup and drop-off line, but at the same time, I don't know how parents feel about their kids being on the bus with a mask on, sitting next, crowded bus. But then again, they have the option to not send their child on the bus if they don't like how crowded it is. But I just, it's a hard thing to.
Right. So maybe the thing is leave it at the 1 mile radius, leave it on the agenda for the 8th. Then you'll have more data points and get the feedback from the parents and see if there's the need there. And of course, it goes with the caveat that, well, I shouldn't say it goes with it, but can we agree to continue all exemptions that we made last year for safety issues?
That we approved last year, yeah,
Into
that makes
this year?
sense.
Yeah.
So remind me of the Hampton Ponds Plaza bus stop is for school of choice students, so that they're not all on
Because
the
it's in-
corner of County and Amy or something,
Right.
okay.
We had to approve it because we had to approve the bus leaving the jurisdiction
Okay.
to do the pickup. remind me when generally or traditionally open house and parent-teacher conferences are, what months those are in?
November and March.
November's open house?
No, usually open house is September,
Okay.
and we have not set that date yet. And I'm going to be figuring out how, do we have I wanted to see what our feeling was tonight. And then we can't have, every parent of Norris School, preschool to 6th grade, walking through the building on one night in September if we're saying it's not safe. So, I might have to have different nights for different grades. And that just puts parents out that if they have a 2nd grader and a 4th grader and they're 2 different nights, they come on 2 different nights.
One possibility may be only have open house for new students,
Or
new
younger, for the
families.
younger grades only.
Right.
Yeah, coming in. I'd like to maintain the policy of Norris being closed to the public. Nobody's in Norris except for student and faculty initially, which means I would probably plan on the November parent-teacher conferences being via Zoom and not in person. I mean, just start thinking about that, but
We have money for Zoom licenses?
if
Did it expire already?
you can use mine again.
Every teacher can use your.
Well, I think that, we can do that if it's under 40 minutes, so everybody would just have to be conscious of the amount of time that they're spending, right?
Yeah, and we can make that decision in October,
Right,
but
I'm glad that you're thinking ahead, because we've
The
had these
school-
conversations, yeah.
We're putting masks on for the week to see how things go. We're doing all these things. I don't see, not that Norris is gonna get a lot of public traffic, but I don't see the need to open the school to the public as it was prior to.
Who would be coming in besides the parent-teacher conferences? Like, who else, when it was open to public, how often are you having the public walking through the schools? I wouldn't expect,
You used to be able to eat lunch with your kids.
Yeah, it means parents, grandparents, you can't go in. You can go and sign, you can stand in the lobby, sign your child out, and that's it, but you can't go into the school. It's just adding more bodies into the
It
school.
means all special ed meetings are gonna be, on Zoom. It feels like we've always done this, because it's been so long. And, right, so parents would continue to not be able to come in for lunch and things like that.
Did the district surrender Norris's Zoom license?
No, we have to renew the licenses, and Kim has been in contact with principals asking how many Zoom licenses we want to purchase. And if we do it bulk, we get a better,
Yeah.
rate. So, I'm thinking of my special ed team leader, myself, my vice principal, keep people in the building that need it, times how much it is.
So that specific technology item is definitely reimbursable on
On the
the
American Recovery Act, okay?
and/or the unspent money that we have for the technology upgrades.
And
Because it's
John,
specifically related, we're only doing this because of COVID.
While special ed meetings can be held on Zoom, if a parent requests us to meet in person, we meet in person.
And if that's the case in the initial beginning, I would suggest it be outside in their tent. Right, and that was the case last year, weather permitting. It came up.
it never came up.
Right. Other than those, are there any other restrictions that I'm not thinking of that were in place that you would want us to lift or modify?
What's the cafeteria gonna look like? Do we know yet or not yet?
Well, if we're doing our best to separate kids, but not necessarily at 6 feet apart, now that we've talked today, I'm going to rework, because I was gonna just automatically go back to 2 grade levels are eating in their classrooms, which is K and 1, because they'd have to be 6 feet apart, and those are our smallest numbers, so we could be 6 feet apart in K and 1, but because we're saying in class, they don't need to be 6 feet apart, I don't wanna put their desks 6 feet apart all day long, because they're gonna have lunch in class. So in the cafeteria, where we have long tables, instead of 1 student at every table, I'm thinking that I'll put 2 students at every table, and maybe everybody will be able to eat in the cafeteria this year, and we won't have to eat in the classroom. It would be, we would put stickers or something on the table so student knows you're sitting at the very end of this table and you're sitting at the very end of this table, and that is 6 feet apart. But of course, with their bodies, they're probably 4. But they will all be facing the same way like they were last year. I'm not gonna have them facing each other in the cafeteria just because they're eating and they'll be maskless.
Will there be sign-in or like assigned lunch buddies just for contact tracing? Probably. That's something we talked about at the Board of Health meeting last night, was for lunches, having a sign-in process, or maybe that's a bigger issue for the older.
We had assigned seating last year by grade level, or by classroom, so if it was 3rd grade, all of Mrs. Rapose's kids sat in this row, all of Mrs. Michaud's kids sat in this row. So this year, if we're within 6 feet of each other at a table, we would have to do assigned seating, so you sit with your lunch buddy every day.
It's probably not possible, but the Board of Health also asked, if possible, to do assigned seating on the buses. So in the event of a confirmed case, you only have to go one student back and forward to get everybody. But without a monitor on the bus, I think it's.
They did it last year.
But
They had their names like on an index card
Okay.
on the back of the seats.
my thought was, I don't feel it's realistic to ask the bus driver to enforce that when they're driving the bus.
Yeah.
So that would be more of an honor system. But if they had assigned seating and then we had that mapped out, so in the event of a contact trace event, that gets turned over to Sharon, who's going to continue next year. Sharon Hart as the contact tracer.
Yep. I think that'll be something that all schools will have to talk to Durham about.
Yep.
Yeah.
Have we thought through what the process is gonna be for students who have to quarantine?
DESI will be giving out guidance within a week about that. So as we know, DESI changes their procedures quite often, but anything about quarantining, isolation, all those procedures, they'll give us a chart.
Okay.
Right. We did talk today about what recess and lunch would look like with grades intermingled. And I don't know if that was something that needed to be further explored, or
I think we need to talk about it a little more.
We meaning administration?
Yeah.
Okay.
And I think we'll be, during our retreat, when we meet next week, we'll be talking about it with the other principals as well.
Okay. There's nothing else? We can, okay. Sharing food for celebrations.
Yes, so, being COVID last year, and we had these conversations prior to COVID, but I think that since we weren't sharing anything last year because of the pandemic, we really strongly feel that we should not be allowing outside food into the school to be shared among the children. So because we are a nut-free and nut-safe school, and because we don't know how clean and sanitized people's homes are, we would rather not have any treats be brought into the school to be shared for birthdays or snacks or things like that. We are going to have a list of things that you can purchase from the cafeteria so that we know that the people serving it are Serve Safe certified, cleanly, sanitized, nut-free. If a particular class has students who have other allergies, for instance, we just feel that it's a much safer option. So parents could purchase a tray of cookies or cupcakes, and we'll have pricing on that, and then you go right through the cafeteria manager to do that. We just feel it's a safer option. I don't think it's a policy right now. It's just something I wanted you to be aware of, that it would go in our handbook.
I think that sounds great.
Last year, I think kids brought stuff in for Valentine's Day, I think it
I don't want to
was.
hear that.
Huh?
I don't want to hear that.
Like, they were put into quarantine though. Like,
Yeah.
Yeah, like they're,
So individually wrapped, it had to come in like 7 days before or something like that, set aside.
I know. This is what I'm going to say.
I'm not saying
I
I
know.
have an opinion, I'm just saying.
No, I know. It's really hard, even that. And I know I feel like I'm taking all the fun, right? But we have very disappointed parents that come to the school when they picked up a box of cookies at Big Y that has a nut and an X over it that says it's like peanut free, right? And they come and they drop it off for Sally or Susie, and then they leave, and then the teacher checks it, and all of a sudden there's a different kind of nut in it and not a peanut. So it's the advertising on the outside that is, making us not make the right decisions. It's taking time away from instruction when teachers should be, teaching, and the school secretary is now calling home, and then the nurses are like, well, everybody wants, whose job is it to monitor this stuff? It becomes an issue. We also feel that, Mom is really good at making these wonderful, beautiful cupcakes for Johnny's birthday, and they're beautiful, and they took a lot of time. And our school handbook says that you need to bring in the ingredients of what you used. And then all of a sudden, Mom's standing at the door, and we're saying, yeah, that ingredient, there's 2 kids in the class that are gluten-free, or 2 kids in the class who have red dye number, whatever, allergy or whatever, we can't serve these. Or you didn't give us the ingredients, and now you have to go back to work, and we're not serving the cupcakes. So it just, I don't want to, hurt anyone else's feelings anymore or be in that position anymore. And I want to make sure the kids are safe, all the kids, and that all kids can participate. So we're able to do that through the cafeteria.
That answer your question about Valentine's?
So it would be,
Yes,
I know,
in detail.
long
Thank
answer,
you.
sorry. We wouldn't accept anything from the stores to be passed out at school. Nothing would be passed out at school.
Regarding the cafeteria, is this upcoming school year going to continue as last year where there's no cost for lunches?
Correct.
And we will let
I believe.
parents know that, correct, for the whole school year.
Yeah.
We'll let parents know that.
Any other business to come up? The only thing I have is I forwarded over to the committee members the 2017 traffic study on Norris that has come back up. Up Pomeroy Meadow Road, as soon as you hit the property line, spending roughly $90,000 to put a driveway in that goes behind that yellow gate, runs up the property line, takes out the trees, and then cuts in. My guess is you would then eliminate that other driveway that's in there under that study.
Does that wreck the fields at all?
No, it just, I think it lets you get like 5 more cars in, because you're not coming into the main parking lot first, where you have to stop because of the buses. But because of last year, with the backup, there's a movement afoot to change that, to change Norris's traffic pattern some way, some shape. So they're starting off with that, and I believe, I could be wrong here, but I think Randall is spearheading that with the Mass DOT to look at. So they're gonna be in touch with more. There's some study funds available to look at that and see what we can do, as well as the, is it the Safe Walk to School?
Safe routes to school.
Safe routes to school, with some bicycling options
Yep.
to encourage that again, which I think that they had done in the past. I don't know if it was during your tenure.
Yes,
Yeah.
yep.
So there'll be more news coming on that stuff.
Is there any talk about crossing guards or any sort of, like the intersections coming from Route 10? It gets a little tricky. As someone who frequently rides the kids back and forth from school, that pickup line is challenging because they swing in, and even, there's nowhere, you can't ride on the road, there's no place to go, kids are all on the sidewalks, and even on the sidewalks, it feels uncomfortable because the cars are pulling right up onto the road and they're not necessarily paying attention, they're paying attention to the cars, so it is kind of a nerve-wracking, uncomfortable feeling with all the cars swinging in and out right there. But I didn't know if they were like, crossing, any sort of like cross, I don't even know where you'd put them, but some sort, aside from the $90,000 to make the new driveway, which only seems to make a difference for 5 more cars, it didn't look like a huge impact. I think the greater impact is lowering the 1 mile restriction and getting more kids back on the buses will probably help the situation faster than adding 5 more car lengths. But it's uncomfortable, the way cars are pulling in.
Right, they go up over the curb onto the
They go,
grass.
yeah, yep. And then they're swinging in and out of that condo road, and they're doing U-turns. So that whole area doesn't, they're just swinging in and out of and pulling right through real quick.
So do you have a comment?
No.
Oh, when that comes
Just
back.
say, I know.
When that comes back up on
To the condo
on the
house
select
lot.
board side, maybe that's, we can participate as a committee in a joint venture. And then the other thing is, I will get you the dates, but your biannual appearances before the select board have been scheduled. So that would be Norris Principal, Hampshire Regional Principal, Superintendent, and/or the business manager. And I think the first one is the first meeting in October,
Biannual, is that,
twice a year.
no, I know, but where did this come from?
It's a program that was called the Quarterly Reports. I'm only 2 months into this.
I've never heard of this before.
You've never gone to the select board before?
I've been to
just
the
give an
select board
update?
for different reasons.
Well, so for this year, it's
But-
meant to be, you come in, it's kind of like the State of the Union. There should be a memo coming out, I know. But, you're gonna, you want to do a better job at this than me? Yeah. Go ahead, Francine.
I have never been invited, so I would love to come.
I think the idea is to get the reports from the source rather than the liaisons who relate to the different committees. I think it's important that the select board themselves and the people, the residents, hear from the representatives. What we have done is made out this schedule, and you should be getting it. But in addition to that, there's an outline of the kinds of items we'd like to see discussed at that meeting, so that, we're all kind of on the same page. And we also grouped them together by categories, so you see you're with all the other educational resources in the town, so that you can hear from one another at the same time. I mean, it's a good way of communicating and hopefully collaborating going forward, but it's, I think you'll be happy that, we've defined the outline, so that you don't have to say, well, what am I going to say?
Right, no, it's
It's
good,
very
it's
clear.
good, yep.
And everyone will be giving the facts, and that will get information out to the people who deserve to hear it.
Okay, thank you.
Yeah.
Thank you.
And, the educational component in Southampton is roughly almost more than 60% of the entire town budget. So I think it's an excellent step in the right direction of transparency and getting everybody on the same page. So
Thank you. Yep.
that email will be coming out.
I wonder too whether roadway paint in front of some of the driveways, even if it's just a little section, like the do not block the box hashes, whether that's a helpful option, because I think some cars just seem to be oblivious. Because I've been in the car line, stopped for that condo association road and waited until there was a clearing, and then proceeded once there was clearance, because in Boston, that's what you do. And other people will pull up right behind me and not stop for that road, even though there's no space for them. So I think they're not aware.
I think all good points to bring up to Randall.
Yeah,
and see how
Because that might be a cheap.
Yeah.
I have no idea what that costs.
Is there anything else? No? All right, then, this ends the public portion of the meeting. Our next meeting is September 8th at 5:30. I'll now entertain a motion for executive session under Mass General Laws, Chapter 3923B, to discuss strategy with respect to non-union personnel, where if an open meeting may have a detrimental effect on the government's bargaining or litigation position.
So moved.
Motion made by Austin, seconded by Allison. Roll call for executive session.
Hampshire, aye.
Rogers, aye.
Great on I.
And Lumborough, aye. We will not return to open session for a vote. Thank you.
Thank you.